Hi, are you suffering from Bell's palsy and you want to increase or maximize your chances of recovery? Then it's very important for you to understand what to focus at what time on your Bell's palsy recovery journey and to work on that in a meticulous manner. This video basically will break down that for you. In this video, you're going to understand three most important things. Number one, how do you identify or understand at what stage of Bell's palsy you are at? Number two, the key focus areas or key goals that you should have in mind depending on what stage of Bell's palsy you are at. And number three, what are the critical practices at what stage of Bell's palsy? This understanding will help you to work on your Bell's palsy recovery in far more effective manner and will give better results. So, what you're waiting for, make sure to watch this video till the end. And before we start or proceed, I request you to hit that like button and press subscribe button so that all the videos that we upload related to Bell's palsy and synkinesis don't miss out on them. I am Physio Meghna Dave, founder and CEO of HealthQ Rehab and a neuro rehab physiotherapist with over 15 plus years of experience in helping people suffering from Bell's palsy at different stages. Let's get started. First, let's understand what is Bell's palsy and what are the different stages of Bell's palsy. Friends, Bell's palsy is a condition in which your seventh cranial nerve, which is a facial nerve which starts from your brain, passes out via your ear and then branches out in 5 branches, gets pressed, compressed or damaged at the ear level due to either an inflammation, infection or trauma. 3 of these reasons will lead to impairment where the supply that's coming from your brain of neurotransmitters that will allow your facial muscles to move will be blocked. So here the key important thing that you should understand is the problem is not with your facial muscles, the problem is not with your brain, it's the pipeline from where the messages from the brain are coming to your face is getting blocked. If you think that working on the face is going to help to recover from Bell's palsy, well, that doesn't work that way. Now, the next thing you should know is different stages of Bell's palsy. Yes, you heard me right. Bell's palsy can be divided in 3 main phases. Phase 1 is the acute phase, phase 2 is subacute phase, and phase 3 is the chronic phase. If we talk about the timeline, the first 3 months, you can call it as an acute phase. After 3 months, it will be the subacute phase. Something which is beyond 6 months can be called as a chronic phase. Now, in each stage, the level of the nerve damage and the condition of the nerve will be different. For example, in the initial phase of Bell's palsy, there will be a conduction block, which means everything that is coming from the brain as a message is getting choked or blocked at the nerve level. That's why your face is completely paralyzed. But as your immunity helps you, as your internal healing process starts working, the pressure from the nerve will start releasing and your nerve will start working back again slowly. That's where the subacute phase comes into the picture, where your nerve is not healed completely but is in the process of recovery. And then the chronic phase is the one where whatever was the maximum recovery that was possible has been achieved. I'm not saying that it will stop, but the process of recovery slows down. That's where it becomes a chronic phase of Bell's palsy. The good news is people recover 100% out of this Bell's palsy in their first 3 months acute phase itself. And only few are left with residuals where they go into subacute and chronic stages. Now, the biggest mistake that patients make when it comes to Bell's palsy management, they correlate their recovery from the facial movements, which to an extent is true. But the treatment goals is completely on getting the movements back. They don't understand it's the problem which is inside the ear that's causing the block of the facial movements. So ideally the focus should be on healing versus they focus a lot on bringing the facial movements back, due to which they make biggest mistake, which is forcing the facial muscles to move even though they are completely paralyzed, which eventually lead to a secondary complication in later stages of Bell's palsy, which is called as synkinesis. So what should be focused on these 3 phases of Bell's palsy? Well, let's start with the acute phase, the initial phase where there is complete conduction block. Now here the inflammation level is the highest. That's where the focus should be on 100% healing of the facial nerve. That's where your medication plays a very crucial role, your sleep plays a very crucial role, your diet plays a very crucial role, and how you protect your eyes plays a very crucial role. Next comes the protection of your facial muscles from atrophy or else from the memory loss, which will happen due to lack of facial movements that the person will not be using that will exist for a couple of months. Along with that, due to lack of facial movements, what will also happen is stagnation of the fluid and blood flow, which makes the facial movements more difficult and painful. These are the four most important areas that needs to be focused on in the acute phase of Bell's palsy. That's why exercises are not the most important thing to do at this stage, versus eye care and facial massages are the most critical aspect to work on. Then comes the second phase, which is the subacute phase of Bell's palsy. Here, your muscles have started moving. You can see some visible contractions, but these muscles are not that strong enough to allow complete or natural movement patterns. This is the subacute phase of Bell's palsy. This also usually lasts between 1 month, sometimes to 3 months, and sometimes to 6 months too. Here, the focus is on retraining the facial muscles and in a very sustainable and gradual way increase the practices of exercises. Here's where the actual role of exercises begin. The exercises should be active assisted, which means partial support from yourself and partial support from the hand. Even as eye movements would have come by this time, only limited eye closure might persist. At this stage, eye care is still crucial. You have to continue taping your eyes, at the same time stretching your eyelids. That's not all. Blinking practice is very critical at this stage. The better you blink, the better will be your facial movements. So, practices that improves eye movement is the key here. But again, that doesn't mean that you should force your eyes to close. Remember, facial muscles are built for coordination and not for strength. And then comes the third phase of Bell's palsy, which is the chronic phase of Bell's palsy. This is where the actual residuals that are left. Here, either certain muscles will not move at all or else partially move, and some muscles will start moving unnecessarily, which will lead to synkinesis. Here, the idea is to minimize or stop synkinesis as much as possible and encourage the right movement patterns. This is where your neuromuscular retraining and proprioceptive neuromuscular facilitation techniques helps. Here, you need a very experienced therapist who understands these methods, these processes, who helps you out to work on your facial muscles. It's not one size fits all approach. Every individual have different muscles that will be affected at a different levels, and the dosage of the exercises has to be determined accordingly. So, the key thing that you should keep in mind is when you are in early phase of Bell's palsy, please don't force or try to bring your facial movements back. Don't try to think that, okay, the more sooner my facial movements come back, the better it is for me. Your facial movements will definitely come back at its own pace. Let it work that way. You take care of your facial muscles, allow it to rest, allow it to relax, allow it to calm down. Second thing, don't overdo your exercises. It will harm than doing good. Number 3 is make sure to take care of your eyes. Your eye is at highest risk at this stage, not in the form of infection, but at the same time the blinks as well, which can impact your vision as well. That's the reason eye care is the prime thing when it comes to Bell's palsy recovery. And last but not the least, you have to work on your rehabilitation of Bell's palsy on a stage-wise manner. You cannot start resistance exercises on day 1. That will not help you out. And that's where a professional help comes into the picture. We at HealthQ Rehab specialize in helping people with Bell's palsy. We have helped over 1,000+ patients suffering from Bell's palsy at different stages. And if you who are someone who is suffering from Bell's palsy or synkinesis and you want some help, you can visit our website www.healthqrehab.com, request an appointment where we conduct something called as Consult for Clarity. In this consultation, your detailed evaluation of the face would be done and we will give you the right roadmap of recovery for your face. So what are you waiting for? The link is mentioned in the description box and we see you in the consult. Thank you.